Hi, everyone. Good day from anywhere in the world you are joining us. We are so glad to have you join this webinar and just join this very important conversation. We would be starting right on, and we have all our speakers and panelists on board. We hope that you are able to engage through the different mediums we have. We have the chat box if you want to share your thoughts, but we also have the Q&A box if you want to if you have a question, and our panelists and speakers will be able to respond. This session has live interpretation in Spanish and French, so please use the interpretation box. For those of you who are using your PC or mobile device, you can just click on the more option, and then it can show you interpretation, and you can switch. Some of our speakers will be speaking in Spanish, one of our speakers actually. So when that comes up, you can also switch accordingly. Thank you again for joining. Now, today, as we are well aware, our conversation is centering on what the space and the landscape of sexual and reproductive health and rights is in the face of dwindling resources and also the age breed, and what that means for us thinking about sexual and reproductive health beyond aid. And as the global landscape shifts, the future of sexual and reproductive health and rights is at crossroads. Today, we want to discuss how we can sustain and advance SRHR in a world where traditional aid structures are evolving, or how may no longer exist as we know them. We look forward to a thought-provoking discussion among today's speakers to explore the role of partnerships, innovative funding models, accountability mechanisms as strategies for long-term sustainability within SRHR. And with that, we are going to give a go to our first speaker, who will be sharing more on the work he does. I'm going to be introducing Dr. Pascale Allotey. Dr. Pascale Allotey is the director of the Department of Sexual and Reproductive Health and Research at the World Health Organization headquarters. Pascale is also a leader in gender equality, health, and human rights. Her recent works include challenging the boundaries of global health, advocating for accountability in the development space, and also decolonization of health and international development, amongst the many important work she continues to do. Pascale, the first question, and the question would love to hear more from you, is drawing from your recent paper, which was published, speaking to this issue on the growing distrust in multilateralism and what that means for the future of SRHR. Would like to hear from you, how can we defend the SRHR sector from the attacks on the evidence, on science, and broadly gender and rights, especially when misinformation and disinformation is in mainstream? Also looking at issue as it is, if we can also get to learn to go back to the world order, where do you think we can really go back to the world order where multilateral organizations such as the WHO and designated multilateral organization with their normative authority on health and countries, can we go back to that where countries can work together on a shared global agenda rather than national interest?
That's a very big question. So sorry, first of all, colleagues, thank you for the invitation. It's such an important and timely topic. It's a little heavy for a Friday afternoon, I must say. And when I started preparing for it, I almost wish I had declined. It is so monumentally complex, and I'm afraid I just won't be able to do it justice. And with apologies, I won't be able to stay long enough for the discussion, and I hope, and hopefully some debate as well, because I'm not sure that everything that I have to say will necessarily fall comfortably for everybody. But nonetheless, here goes. This is a time of profound disruption and deep contradiction. So on the one hand, sexual and reproductive health and rights, SRHR, have never been more clearly articulated in global norms. everybody knows what, when you talk about SRHR, at least it's something they've heard of, whichever way they fall. And on the other hand, the very idea of these rights that are grounded in science, autonomy, dignity, is under attack in multiple regions. And here's the paradox. The SRHR movement, born from resistance and human rights struggles, is increasingly portrayed as foreign, ideological, and even colonial. Yet many of the values we promote, pluralism, respect for bodily autonomy, diversity of identity, have deep pre-colonial roots in the very cultures where they're now being rejected. If we want to defend and advance SRHR today, we must begin by grappling with the paradoxes of shifting power and contested legitimacy. We must acknowledge the uncomfortable truth that even as we speak of decolonizing global health, we are still operating in a system that is shaped by colonial logics. And I say that knowing that I sit in a multilateral system. So funding still flows predominantly from the global north. Technical authority remains centralized in multilateral institutions and academic centers, most of which are located in high-income countries. And global norms are negotiated in Geneva, New York, Washington, and so on, far from the communities whose lives they most affect. Traditional funders of SRHR, and this is why we're here today, traditional funders of SRHR, many of whom have been long-standing allies, now find themselves navigating geopolitical headwinds. At home, they face rising nationalism and ideological backlash across a whole range of countries. Abroad, they are accused of advancing foreign agendas. The result is that even progressive evidence-based SRHR programs are seen by some as coercive or externally imposed. And this is the reality of our work here in HRP. And so the very agenda that was built over decades of local mobilization and feminist organizing, one that is clearly owned and yet equally contested, is destabilized. We're now witnessing a moment where the struggle over SRHR is not only about policy, but about legitimacy, about narrative, and about identity. So this is not just a funding crisis, it is a crisis of legitimacy. Disinformation is now mainstream. Misleading narratives amplified by digital media, political movements, and even some state actors seek to reframe SRHR as an ideological threat. As our own work here in HRP and WHO has shown, misinformation and disinformation are not just communication challenges. They are political tools used to erode trust in institutions, science, and rights-based policymaking. And moreover, the anti-gender movement has become adept at appropriating the language of women's health and family values to push exclusionary agendas. These actors present themselves as protectors of tradition, sovereignty, and culture, while systematically opposing gender equality, rights, and access to interventions like safe abortion. So in this contested space, SRHR is framed as a Western value rather than a universal right. But we must insist the values underpinning SRHR are not imported, they are remembered. They exist in the diverse sexualities, gender roles, and care systems that colonialism actually tried to erase. And scholars like Silva Tamale, for instance, argue that decolonization must include recovering indigenous sexualities and epistemologies and not simply rejecting global frameworks. So, and directly back to your question, where do we go from here, especially as funding contracts and the multilateralism phrase? And part of the reason that my time now is limited is that we have to deal with these realities now. I think we must begin with humility and courage. The SRHR movement needs to take responsibility for some blind spots that we've had, for reproducing hierarchies of knowledge, for failing to center community voices, and for allowing technical language sometimes to distance us from political and social realities. We must be clear-eyed. In some cases, our global health architecture has reinforced power asymmetries rather than dismantling them. Donor-driven conditionalities, even with the best intentions, can trigger backlash and has, appearing extractive or disrespectful of local autonomy. And this was one of the key findings of the Guttmacher-Lancet Commission in 2018, which underscored how restrictions on SRHR often emerge not only from domestic ideology, but in response to perceived external pressure. We can't outsource legitimacy. We must build it by investing in our local feminist, youth-led, and indigenous organizations, and by fostering epistemic justice that values lived experience as much as peer-reviewed evidence, and by forging partnerships rooted in trust, in shared purpose, and long-term solidarity. And at WHO, certainly at HRP, we are working to meet this moment, defending science integrity through new initiatives, including, if you're available, an upcoming webinar series as well, documenting the impact of misinformation and deepening partnerships across health systems and civil society to co-create evidence-based guidance that resonates across our different contexts. So we must reclaim SRHR not as a Western project, but as a deeply human one, rooted in our plural histories, sustained by collective resistance, and grounded in the unshakable belief that all people everywhere have the right to make decisions about their bodies, about their lives, and about their futures. Thank you.
Thank you so much for that very important reminder, Pascale. And as you rightly said, reimagining and rethinking the current status quo needs us to very much speak truth to the issues as it is and contextualizing what aid and support and centering sexual and reproductive health across different spectrum is, and leaning more into the important value that solidarity through multilateralism provides, even as national interest keeps cropping up to push back the progress we are making. At this point, we are going to be moving on to our next speaker, who is on the call. We have Marta Royo on the call, and Marta Royo found a great opportunity to serve as the rights activist when she became the executive director of Profamilia in 2012, which is Colombia's longest-standing non-governmental organization that provides, protects, and advocates for sexual and reproductive health and rights. This responsibility has allowed her to help achieve significant political and social transformation, which aimed towards improving the status of girls and women in Colombia, including but not limited to leading legislation on the National Policy on Sexual and Reproductive, the National Policy on Sexuality and Sexual and Reproductive Rights, making sure these rights are recognized for people with disability, eliminating the barriers that prevent women from accessing safe abortion, and turning Profamilia into the leading provider of quality abortion services in Colombia, amongst the many very important work Marta and her organization continues to do in upholding the rights of women and girls and ensuring that people are not left behind on the basis of their sexual and reproductive health. I'll be inviting Marta to share results from her very rich experience. Firstly, if you think, Marta, that SRHR services can be sustained and restored without aid or without reduced foreign assistance and ODA, as we say it. Over to you, Marta.
Gracias, Goodness, y buenos días.
Thank you very much, Goodness, and good morning, everyone. I will speak about, I'll speak in Spanish, echoing on the decolonization efforts, Spanish being such an important language in the world. And Dr. Pascale, your words really resonated and everything that we've done throughout the years. I direct an organization, Profamilia, that was born from and was devoted to the rendering of sexual health and reproductive health products and materials. And when I started working in this organization, we were broke. We didn't have enough resources to pay the payroll of Profamilia, of the organization. And why do I share this from the start? Because in this time when absolutely everything is crumbling down, all of the work that has been built, I believe that the experience that we had in our organization is very closely related to this. So Profamilia was in the brink of disappearing because throughout the years, we had developed a dependency on global cooperation mechanism, and that hindered the organization to understand the context, to understand how the context was actually changing, to the point when these organizations removed this support or this funding. Profamilia had a very, very difficult time in remaining in existence. And this is a very sad situation because right now the situation is forced upon us. All of the organizations, civil organizations that work with clinics, that work with advocacy and all of that, the whole range of work that we do in the area of SRHR, most of the organizations are facing similar situations. So what we did that was very important was to remove completely how the organization was operating or things that were operating in the organization. The first thing we did was to analyze our human resources payroll. We realized that we had more than 50 people hired at the time from USAID, understanding that at that time in 2012, we didn't have even resources from USAID. So we needed to do a very objective, very cold even analysis of the organization so that we can understand that there were expenses coming from the organization that we had no way of paying. And that was a very important step first, because based on what we are seeing right now, which is a reality, and just as Dr. Pascale was saying, just or unjust, at the end of the day, this is the reality that we need to decide on. And to do that, we need to understand where are we standing right now. And that is how we started to implement a series of strategies to understand what were the most immediate opportunities we had before us. Another example is that we needed to do a partnership with a local pharmaceutical company to work with them so that many of their inputs or products we could sell more. And that was a vote of confidence from them, but we were committed on actually delivering on that commitment. So we sat with the national government and also trying to analyze what were the advantages that we had as an organization. And we came to the government to say, we have these two programs and we want to be part of this circuit where health services are provided. And again, this was a vote of confidence on the organization, but we were very rigorous on the inside to actually meet our promises. And we started to build a network of young people because we knew there was a huge need there. So the most important messages here are, number one, define your priorities. We need to define our priorities. We need to make decisions, even tough ones in many cases. And in many cases, the only thing that we will only be able to do in many countries will be minimum to guarantee that the discussion, the conversation around the importance of sexual rights and reproductive rights is on the table. That's the minimum level. But if we do not have the resources, we don't have to have a big organization right now, but at least to have people that are keeping this conversation on. Also, partnerships, public-private partnerships. That's a very essential part. And sometimes we think that we need to partner with the biggest companies. Perhaps we have a small pharmacy company that can provide a product that we can also use in our programs. And also service provider models. Right now, a good model of sustainability is telemedicine, remote services. And our doctors provide the services from their homes, and that is less costly. People don't have to come to the clinic necessarily. And my final message, perhaps, would be that the moment that we are living right now is very hard, but I agree with Dr. Pascale. Sometimes we speak very technically, and let me be blunt, I think that sometimes when we present ourselves to the populations, we believe that our discourse is not connecting with the population. But we need to understand this population. We need to understand how do we connect with them. And the way to do that is to help them understand that sexual and reproductive rights is a public health indispensable topic for the well-being of people and communities. So I believe that we need to be also humble in challenging ourselves, because part of the reason why we're experiencing this right now is because we haven't been able to connect with our target population so that they can understand. In my case, for example, sometimes we can say, okay, we don't sit with indigenous population because they have a very cosmovision. What they need is for me to come with a specific service, with the abortion service, and with concrete specific actions. And I think that this is an important reflection. This doesn't mean that we will not continue to fight for these rights, because these are human rights that we believe on. But we need to understand better the populations that we serve, and how can we understand this scenario, this context. How do we assign responsibilities, right? We need to work with local civil society organizations that continue to talk about this. And based on all of the challenges that we have, we need to also commit to, or to actually make sure that our word is worth something in the populations that we serve.
Excellent. Thank you so much, Marta, for sharing those. I really hope that as we have quite an audience, we are reminded in many ways the important power that partnership holds, as you rightly said, and with the work you and Profamilia is currently doing, and that with the changing dynamics as we see it, we are able to redefine the priorities in our communities and tap into the power of local communities, local civil society organization, indigenous communities, and what that holds in providing the much needed resources, financially, materially, human resource, to continue to push this work and advance sexual and reproductive health in all its spectrum. I will be moving on to our next panelist, who is right here to continue to take this conversation further. We have Marevic Parcon, and Marevic Parcon is the Membership Support and Development Director at IPPF, where she leads the integrated support and development of members association and collaborative partners across the Southeast and East Asia. Marevic works closely with other IPPF regions and global teams to strengthen the Federation's impact on sexual and reproductive health and rights globally. Prior to IPPF, Marevic was Executive Director of the Women's Global Network for Reproductive Rights from 2018 to 2013. And she continues to do amazing work across the Southeast Asia and broadly the Asian region in advancing sexual and reproductive health and rights. Marevic, my question to you is, looking at the current landscape where we see national governments centering their interests, can we and should we hold national governments accountable to expanding access to SRH services? And in your experience, what examples can we draw from the abortion movement that the broader SRH community can learn from in this changing time and so much uncertainty with funding to continue to do this important work of advancing SRHR? Thank you.
Thank you so much, Goodness, for this opportunity, and good evening, everyone from Kuala Lumpur. Today, as abortion rights movement mobilized for the Global Day of Action to Destigmatize Abortion, which is today, is March 28th. Yes, and I say yes, absolutely, we should hold governments accountable to SRHR. As someone, as you already have mentioned, as someone from the Global South, and specifically in the Philippines, where there is deeply entrenched patriarchal regressive structures that continue to deny our rights to sexual and reproductive health and rights. I know for sure that we always assert that SRH is a human right. But from this end, my government is one of those governments who first signed human rights agreements. But as we know for sure that human rights commitments mean nothing to anyone if they don't translate into action. Hence, accountability really is non-negotiable in this context. And following the intervention from Dr. Pascale earlier, when she said that we have to emphasize on how we decolonize our framing. And on that, we ask accountability to whom? Who are we accountable to? So often, the frameworks of accountability are donor-driven. It is heavily bureaucratic. It's highly technically rigid, and it's not designed for the capacities of grassroots to engage. So what we really need is a community-driven and grassroots-led accountability frameworks. This means trusting feminist and local movements, reinforcing, resourcing, and reinforcing them directly, dismantling the colonial legacy of top-down development. So, for example, in my experience, I am very, very proud of my engagement and how we also establish and continue to be part of the Philippine Safe Abortion Advocacy Network in the Philippines. We work in one of the most legally restrictive contexts in the world that criminalizes abortion without clear exception. Our abortion policy is deeply rooted from colonial and antiquated law, which is actually really from the canon law from way, way, way back in the 1800s. Yet in that context, we pursue accountability for, and I will just, read this out loud, for 11 women who die each day due to unsafe abortion. We are seeking accountability for these lives by building movement to decriminalize abortion and advance a broader framework of reproductive and social justice in the country. We do this by destigmatization, decriminalization, and demystification of abortion. So over the years, as the example of the Philippine Safe Abortion Advocacy Network, our work is very much grounded on progressive, rights-based principles that we challenge the conservative norms and elevate the collective and compassionate advocacy. We integrate abortion rights within the broader social and economic justice struggles. We use activism to normalize abortion narrative. We engage human rights mechanisms such as in the UPR, CEDAW to hold our government accountable. And certainly, we are centering our strategies in rights-based education, intersectional analysis, and collective decision-making. We are very aware that we are on this for a long haul, so we are facilitating and nurturing intergenerational knowledge sharing. We shift narrative around abortion by building a strong, diverse alliances with all other sectors that we can tap on, including in the global, engaging in the global networks. From this experience, we know and we can learn that SRH, access to SRH can be reframed and also always been reframed within the healthcare and justice framework. We need to reinforce and collectively strengthen our movements through the multi-sectoral collaboration with the feminist, youth, legal, health, and health communities, because we have to emphasize that this is not a single issue fight. We always also assert that we are centering in the margins. We are on the margins, that it is the young people, the LGBTQI folks, persons with disabilities that are most impacted by the lack of access to SRH, specifically in abortion. And in this view, in the Philippines, even when, for example, the decriminalization of abortion in the Philippines is going to be won by us feminists and abortion rights activists in the country, we should not stop protecting and advancing our rights, as we have seen how fragile and easily can it be struck down in our laws, in the documents of our governments. And so accountability is a power that we hold as movements. It is also our duty to pursue as SRH advocates and activists. For us, accountability means we collectively push for meaningful and impactful investment in grassroots movement. Accountability means trusting the people who work on the ground, because we know what we need. We already are doing the work, even in the most difficult situation. Thank you so much.
Great. Thank you so much for that very important reminder of the broad spectrum of what accountability means. I like that the audience we have cuts across people working at the grassroots, academic institution, multilaterals, INGOs, and it speaks to how at the different organizational level or work you do at the grassroots or high level, you hold the power to push for accountability and to draw strength in this very important time. How much different would we see the current state of things if from different ends we are hearing loud, amplified voice, speaking truth to power, holding the different institutions, governments, and groups to what the issues are, and showing clearly where the evidence and outcomes on the impact of the difference SRHR is making in communities are. So we all hold that power, and I hope we can tap into it, drawing from the excellent example that we've seen in the Philippines and what Marevic has shared. At this stage, I'm going to be moving to our next speaker, who would be sharing more into what ICFP is doing. So on the call, we have Phil. So we have Phil Anglevich, and Phil is the current director of the William Gates Senior Institute for Population and Reproductive Health. Phil is also the principal investigator of the Performance Monitoring for Action project. In his capacity, he provides overall strategic direction to PMA and oversees the project's technical aspects, including survey operations, data management, and analysis. Phil, I would love us to hear a bit more into what ICFP as a community is doing in these very challenging times. 2 weeks now, I guess, we had the much needed and strategic convening on the future of family planning. And we would love to hear a bit more on what were the key outcomes from that convening and next steps in terms of commitment that was made at the convening from individuals or institutions. Also, it would be great to learn about what equity to action means for ICFP and building into ICFP 2025, as many of us are leaning more now more than ever to the ICFP platform as a key opportunity to see what centering and advancing equity is. So how the Gates Institute is planning to utilize the ICFP platform to further these priorities, drawing from the outcome of the convening. Over to you. Thank you.
Thanks very much, Goodness, and really appreciate the chance to speak on this call today about exactly what you described. So I want to start with the convening, as you mentioned, and maybe starting with how we got to where we ended up with the convening. So the convening is something that we had planned for several months, and it was originally intended to be a drumbeat event for ICFP. So we would introduce ideas that we would later, follow up with at the conference in November. But then when all these U.S. government changes were implemented in mid-January, we realized pretty quickly that we had to repurpose this event and shift away from the initial topics that we had in mind and directly take on and tackle the issue of this dramatic change in U.S. government policy towards foreign assistance. So as a result, what we ended up with at this convening was a set of a few connected themes. So first, we wanted to make sure that everyone was on the same page in terms of what's the impact of these U.S. government changes and especially the dismantling of USAID. We started with some reports on macroeconomic impact on foreign assistance, as well as the impact on particular countries, and then on certain subtop areas within the field, like policies, programs, data and research, and financing. So after we understood what the impact was, we moved on to what's our response. So acknowledging that with this dramatic change to the field and USAID's dismantling, we can't use the same strategies and approaches that we had before. We had to acknowledge the fact that this would be dramatic change for the field that would require recalibration of the work that we do to be more efficient and effective in the wake of this dramatic change. So after we discussed how our strategies can change to be more effective in the future. And then we also talked about how we can move forward. So what are the next steps that we need to do and priorities that we need to have in this new environment? So we need to, of course, focus more on advocacy, expanding our support base overall, and also maybe reaching out to other fields that are equally affected. And then thinking about how we can use, what structures can we use to move forward with these discussions. ICFP, of course, I think is prominent with this, and we're promoting ICFP as a main vehicle for continued discussions of these topics between now and the conference, and then of course afterwards. So the main outcomes of this convening, I think, are first of all, I think we want to push the priorities that we identified at this convening. We want to continue to push them forward. So we want to make sure that the ways in which we're going to have to adapt as a field are well known, and that we can, continue to form a community and join together to push these new priorities forward. So that's one next step in commitment. Second of all, we want to make sure that we continue to build attention for the field as well. One way in which we can do this is FP 2030 unveiled their Made Possible by Family Planning campaign at the convening, and we encourage everyone to tell their own story about Made Possible by Family Planning. So I think we should wanted to encourage everyone on this call to think about how family planning has changed your life and to present that story for FP 2030's platform. In order to move forward with some of the discussions that we had at the convening, I want to encourage everyone to join an ICFP subcommittee and be part of these discussions. We have subcommittees defined according to a lot of these priorities that we identified at the convening, and you're welcome to join one of these subcommittees and be part of these discussions as we recalibrate the field and think about how we need to move forward. Of course, we want to make sure that everyone attends ICFP and submits an abstract. So we've extended the abstract submission deadline to April 19th. And so you have just less than a month to submit your abstract, but we've made sure that we've tried to accommodate for these changes to the field as much as possible with ICFP, and encourage everyone to attend the conference this November. I think it's important for all of us to think about how we can make a commitment to the field. These commitments could be big or small, because I think if we all make a commitment of some form, collectively, that will go a long way towards our community making changes to the field and moving forward with where the field needs to be. So that kind of collective action, I think, is a priority at this point, when we really need to solidify our foundation and find ways, I think, to channel our passion for the field into something really productive and meaningful for the work that we do. And then finally, I encourage everyone to contact us with ideas, either by joining an ICFP subcommittee or emailing us at ICFP directly. We're always looking for ways that we can better kind of harness the ideas that are happening in the field right now and people's devotion to the work that we do. So please contact us and don't hesitate to reach out. Now, finally, I want to talk, goodness, you asked about equity. And we decided late last year that the theme of ICFP for 2025 was going to be equity through action, advancing SRHR for all. And we think this is a key concept for the field because, just like Dr. Allotey said earlier, everyone should have the right to have the number of children and the timing of those children that they want. That's a basic human right, and it's something we feel very strongly about. But I think we have to acknowledge at this point that equity, I think, is even more important now than it was just a few months ago. Because anytime there's these huge policy changes that have huge impact on the field, we know that the impact is not felt evenly across populations. People who are relatively advantaged tend to recover from these kind of shocks or policy changes. They can adapt more effectively, whereas groups that are vulnerable oftentimes have challenges with this. And we've seen this with COVID. We've seen this with climate disasters and in many different forms. So we expect the same to be true here. So I think we need to make sure that as we move forward as a field, equity is center to how we think about our new strategies to make sure that we don't leave behind these vulnerable groups like disabled populations, youth, low-income groups, and migrants, and so on. Also, I think equity is a big part of SRHR, family planning, reproductive health, in the region where we're hosting ICFP for the first time, Latin America and South America. Anytime you talk about these dynamics in that region, I think equity is a topic that commonly comes up. So we have the right topic in the right location. And we're very glad that equity is the theme of our conference. And despite some opposition, it's going to remain so in November. So I'll end there. Thanks again for the opportunity to talk more about ICFP and the convening. And again, please don't hesitate to reach out if you have questions or comments. And if you want to join an ICFP subcommittee, submit an abstract. And I look forward to seeing everyone this November in Bogota.
Great. Thank you so much for sharing those. And I want to believe that for every one of us on this call, we can hopefully see one or two of the different opportunities that the ICFP platform offers for us to build even stronger in these times when it comes to advancing SRHR. And I, as the member of the Power Shifting Subcommittee, also invite you to be part of what we're doing. But across the board, across the different subcommittees, ICFP is hoping that we can be united on this front at an individual level, as a collective, as organization, to build momentum in centering equity and advancing SRHR. I will be moving to our other speakers. Marta, I don't know if you're on the call, but we are getting some very important questions where folks are trying to understand. Are there examples where we've seen how there have been progress or SRHR programs that have been successful, that have successfully transitioned away from donor dependency? And if in your experience, there are things we can learn from some of those, given the current climate of funding for SRHR programs. Thank you.
Thank you. Gracias. No, claro que hay
Thank you very much for this question. Of course, there are many examples. And what I have to offer this webinar is, of course, the Colombian example, and how throughout the years, with all of the components that our panelists here have mentioned, the advocacy for feminist groups, but also for young people, is extremely important. In Colombia, we have a public health model that has all of the sexual and reproductive rights included in the core. And that is a result of many years of working with civil society organizations and providers who worked together with this discourse. So one of the most important components is to continue working despite of the complexities. And I loved the words from Dr. Pascale, because at the end of the day, the only ones who can make that happen are the organizations and civil society organizations that are local, because that's where the lived experience and the numbers are and should be put on the table of governments, so that those services can be included as part of the main core services. Currently in Colombia, abortion is something that is actually paid by the public health service, and that was an amazing achievement. And another point is the diversification of income sources. And I insist that how there has been this dependency on the global north, but also the idea of developing programs with funders. And I think that this is a global call for all of the donors community. Of course, there is a lot of thankfulness because there has been a lot of things that have been achieved with these funds. However, I think that the relationship that we have needs to change, the way that we partner. And I love examples, and I remember one example for the abortion program many years ago, that it had a series of requirements, and we were able to demonstrate that some of those requirements were actually going to be materialized in the populations. And having this type of conversations with funders by means of active listening and to show with arguments why those initiatives were going to have a certain impact or a negative impact or positive impact allowed us to be in a different position with that donor. And now, 10 years after working with them, we are the main service supplier of abortion in the country. Why? Because we were able to connect with them in a deeper level. And also, these actions being implemented in a different way locally, that was a crucial part for the court to finally decriminalize abortion. So it's always the stories of the people that live in our countries that have the weight of the argument. And I believe that we are also at a time where we need to use technology. And when you look at countries that have a lack of resources or that have poverty conditions, but what they always have, it's probably or usually a smartphone. And I believe that technology can also help us to be more efficient, to reduce costs, but also to have greater reach with populations. So I think that's a very interesting question that I hope in ICFP we can talk about that, because the use of technology for the work that we do is something that is crucial, and I believe that it's just starting to be a reality for the South-South population. And that's why I am super excited of what's to come, despite the complexities. And I am super happy to be in this conference because I believe that there are many success cases in South America and the Caribbean to understand how we can make progress in the most adverse contexts. And we have been able to work without funders and with cooperation mechanisms of foreign aid. And I believe that this South-South cooperation is more relevant now than ever to tell the story, of course, of the challenges that we have. Of course, we don't have an ideal scenario, and there are many dictatorships in the region that are really questioning human rights. So this makes our context very difficult, but there are many enriching experiences there. And the idea is to tell those stories in ICFP. We all need to have some trade-offs. And an example that I want to tell right now of something that is happening that pains me a lot, which is what's happening in Africa, for example, the need for reproductive and sexual rights products. So all of those that are involved in the products that we are providing, and to understand that governments also need to provide and to be involved, for example, in this case of birth control products, because we need to have partnerships with the public sector so that they can understand this as a public good, something that is going to favor them. We currently have a lot of partnerships with private companies where we come in with education days and health providing days, because they are benefited from the fact that women in their companies can exercise their reproductive health and autonomy. So all of this idea of analyzing organizations, which is something that is very cold, right? So this is something that we need to do. We need to have people we trust to analyze our finances, to have a real conversation on that, because we are not perhaps very educated in terms of finance, but to have someone that can allow us to understand the needs. And this is a very business type of talk, but this is a very important discussion as well. And when we work throughout the years with various donors, we were able to use many of these resources to strengthen our organization very well. So part of the cooperation or the organization is not only about providing a service, but also to understand what type of that cooperation helps organizations to leave installed capacity, which can be perhaps hiring a person in marketing to understand how to perhaps market a product, or a finance person, or an IT system, or an IT person. This invitation to donors and to funders for in this changing world to analyze the possibility of doing that is one of the paths, so that we are not again back in this situation that many things are about to disappear because we didn't have the ability to foresee and to develop our installed capacity so that we can survive future crises, or at least to be in a better position to survive them. So I insist on the fact that I am still a person with a lot of hope of the community work. The fact that we have more than 200 people here today listening to these ideas and thinking about this is something really powerful. And this is also an invitation, of course, being Colombia the host country for ICFP. And this has, of course, received a very big blow in terms of resources so that we can help people to attend the conference. But that is the space that we have currently so that we can turn around all of the work that we are doing. I think that our work is too important to just keep it in one place. We need to have these conversations here and elsewhere, and to send a very important message to governments and to the world that this is not only a right, but a human need, just as eating, breathing, that is also the level of the need of sexual and reproductive rights. So I think that, of course, it will be very difficult in terms of resources, but we need to do as much as possible, as much as we can, because this can be a very powerful space to reconnect with the population, to reconnect as countries, to exchange experiences. And we're talking about the future, but this is, of course, an immediate future, because the complexities are here. But I trust that we can all continue serving our populations. And my last message is that we also need to take care of ourselves. And we understand that we're frustrated, we are tired, we are confused, we don't know where things are going. And so it is important to bear in mind that we also need to find spaces of care with our children, with our family, with sports, if it's on our own. We need to take care of ourselves, because those are the moments where those frustrations and this anger can block ourselves for decision making. This is, of course, a very important time for decision making, but let's take care of ourselves as well.
Thank you so much for centering self-care in the midst of this. As we know it, many of our colleagues and many of us on this call may have lost our jobs, and how all of that is coming down to our energy and, I mean, enthusiasm to continue to push this work, to continue to show up and push back. So thank you for highlighting that important concept. I also like how that we are reminded to tap into the resources we have around us, leveraging on technology, leveraging on partnership, public-private partnership, grassroots partnership, and even local resources to further this work. Thank you for those important reminders. I will be moving to Marevic, and look, Marevic, I have one question for you. We would also be getting our wrap up quickly, but it would be great if you can get this response in 2 minutes. Marevic, how do we straddle both the advocacy and service delivery aspect of SRHR in the face of, I mean, slimming resources, that we ensure the services are equitable and right-based? And how can grassroots organizations sustain their work on sexual and reproductive health? And if you have maybe opportunities that this hold for us when it comes to, say, universal health coverage, sustainability, and effort that communities are pushing back. Thank you.
Thank you, Goodness. Definitely, yes. Advocacy and service delivery are not separate. They are not separate entity. They're not distinct from each other. They are interdependent and often inseparable. A safe abortion provider is also an advocate for safe abortion rights. A safe abortion provider can also push for changes in the law for destigmatization at the community level. To talk about, normalization of abortion in a very, very pocket system of the society. We at IPPF, for example, we ensure that our MAs are able to provide SRH services and as well as really engaging in the policy environment. And we challenge and transform the policy environment for us to be able to make access possible. So we always question what good is a right if we don't have access to, to the services that should come with it. Service delivery, especially by community-based providers, is where the rights become real. It will be real when it is actually really there, when it is most needed. I have only 2 minutes, as you said. So in the Philippines, for example, grassroots organizations are often first responders and last safety nets of these, services, both in the advocacy and the actual service provision. They're not just delivering services, they are protecting dignity, they are pushing and advocating for agency. They are in a war-torn area such as in Palestine, where they are also life source and survival for many. So hence we operate in a very repressive, and with chronic defunding and underfunding. But nonetheless, we are on the front line responding to the urgent needs. And so both of that actually really would not come from the fact that you are just a service delivery organization. You are also transforming societies. You are also transforming mindsets and governments. And what are those opportunities that we can actually hinge on? Right now, we do have and should make, an opportunity under the universal health coverage. It is within our hard-won fight at the accountability mechanisms. We have to, we must demand that SRHR, including safe abortion access, would be integrated in the essential health benefits of a country. Not just an add-on, but really within the human, within the health, public health system. We need to make sure that the localization, there's that localization of sustainability efforts across, and that localization would be based from the need of the community. And we have seen how the, sustainability efforts have been done in the past, but wasn't really sustainable because it's not based on the actual needs of the community. And so ultimately, we have to ask ourselves, what is this for? Why do we care so much? And ultimately, also, we know it is because that all of these rights that we have, one, are especially by the people who actually really refuse to be erased, refuse to be rendered invisible. So yeah, thank you, Goodness.
Thank you so much, Marevic. And absolutely how you say that we need to rethink our advocacy and service delivery on centering the health needs of the community and what sustainability means in this context. We would like to invite everyone on this call to share your thoughts on how ICFP can be a platform to unite us all in this time. How can ICFP be a platform? And as we are getting those responses, I'm going to invite Phil to share with us quickly, still on that same question. Phil, how do you think ICFP can be a platform to unite us in these present times? Thank you.
Thanks very much, Goodness. And I think, first of all, just to make sure I'm clear, ICFP is rapidly changing what we plan to do at the conference this November to make sure that we continue discussions about these critical topics. So given the huge magnitude of these recent policy changes, we're going to make sure that this is a huge theme for ICFP this November, and we can build on the discussions that we had at the convening I mentioned earlier, talk about the impact, how strategy needs to change, and add the importance of advocacy and next steps. Now, in order to make sure that as a conference, we're able to adequately address, I think, all of the huge impacts of this policy change for the field, we need your contributions. So I again just want to ask everyone here to please let us know what you think are the priorities moving forward in this new reality, and make sure that you express those to us through an ICFP committee, through colleagues, so we can make sure that we can incorporate all that into the conference. But I think when we think about how ICFP could be a center for how we move forward in this, one thing is key for me, to make sure that we are action oriented. I think in how we end these discussions, we need to think about what are the next steps, what can we do individually and collectively to make sure that we're moving the field forward. Because I think it's only through this collective action that we'll be able to actually navigate through these difficult circumstances and challenges. So in a way, this is, I think, a call to action. We should all think about what we can do to move the field forward. And again, I think when we band together and we all do something, it's going to turn into something incredibly powerful. And I don't need to tell anyone on this call that family planning, reproductive health, SRHR as a field is characterized by resilience, strength, and collective action. So I think this is nothing new to us. We have this kind of history, these kind of reserves, and this is how we usually operate. So I know we can do it, and I look forward to ICFP being a center for how we move forward through these circumstances.
Absolutely, Phil. I strongly believe we can do it, and the united force and efforts of everyone can get us there. So yes, as Phil has rightly said, let's continue to engage through the subcommittees, through, just shooting us an email at ICFP to learn how we can unite strategies, the action, the priorities, to push back on the pushback, to continue to center equity, to continue to do this important work. We are already at the hour, and I'm just going to invite Marta and Marevic in 1 minute. Going back to what the topic of the conversation is, what does imagining SRHR beyond aid mean to you?
En mi caso, significa seguir juntos.
Well, in my case, this means to work together, to remain convinced, to connect with the population. We need to talk to people directly in such a way that they also connect with our fight. And we need to know that the history of humanity is of highs and lows. We are in a low right now, but I am sure that the future holds very interesting and meaningful things for us, and we should never forget the successes that we've had in the world. We now have a population that knows what we are talking about, and we now hope that they can join us in continuing the work, and we cannot let this disappear. Thank you.
Thank you so much. Marevic?
SRHR, our rights has not been given to us. We fought hard for it. We shaped it. We defended it. We claimed it with our collective power. We have been persisting and resisting forever, and we know. And this is not, as all of my colleagues here said, this is nothing new to us. But then that kind of resistance and persistence also is not endless. So we need to have that collective hope and hug each other right now for us to be able to continue, and for us to be able to reimagine SRHR beyond aid is to also reemphasize on decolonizing our work, our movement, our language, etc. We have to, again, recentering our work in the lived realities of the communities that we are serving. We really have to make sure that we are working based on our quest for justice. And it is from the bottom-up approach. And Kelly asked me earlier, how are we going as feminists approaches to this? How can we actually really, put forward the approaches of us feminists in this context that we are in? And I would say that it is more than ever that we need to regroup, reorganize, insist and assert that our work is interconnected, that we are a collective, that we have that power, and we are unapologetically political. Thank you.
Unapologetically political we are. Thank you so much to my amazing panelists. Thank you, Marevic. Thank you, Marta. Thank you, Dr. Pascale, who has dropped off at some point. And thank you, Phil. for joining and enriching this important conversation that is one of many more that we would be having within the ICFP community and various platforms and organizations who are speaking truth to this issue. I am seeing the amazing comment and feedback that many folks have been sharing. Unfortunately, we don't have time to read, but we have taken note of them, and we would continue to integrate these suggestions and ideas in the build up towards ICFP, but also the many organizing that is happening among organizations and groups as we are strategizing on the current funding climate. We encourage you all to stay connected through the ICFP platform. At the Power Shifting Subcommittee, we have another webinar coming up on the 8th of March on language inclusivity and breaking down the barriers when it comes to sexual and reproductive health, language and engagement. We hope you can join that. And broadly, let's continue to hold ourselves together now more than ever as a collective and centering the communities we serve and tapping into the power that that holds for us beyond aid, because we would always have ourselves and these issues together we can be able to unite and overcome. Thank you so much for joining again. Sincere apologies for going 5 minutes over time. We hope that you enjoyed this session and you continue to stay connected and advance equity in the work you do.